welcome back to another episode of Health Yes, here at Cameron County Public Health, where we talk about all things public health and more. I'm your host, Javier C.
And Andrea Gomez.
And today we're here to talk about oral health. Joining us today from Key Dental is orthodontist Dr. Jessica de la Fuente. Welcome to the show.
Yes, of course. Thank you so much. Well, I'm Dr. Jessica de la Fuente. I was born and raised here in Brownsville, Texas, and I, that's where I grew up, where most of my family resides. Then I did go to college at Baylor University in Waco, and did my dental school education in UT Health San Antonio. So I've been working as a dentist for several years, and I'm grateful to return back to my hometown, serve the community where I was born and raised, and thankfully, my husband and I recently opened our own dental office where we serve the Brownsville community there as well.
That is so cool.
Nice. So what are we here to talk about today?
Well, we're going to talk about the importance of oral health.
There you go.
And how important is it to tell us?
Yes, of course. And I mean, that's an excellent question. Oral health is super important because it can affect the rest of your body. As you can imagine, the mouth is an entry point to whatever goes into your body. So it can be linked to several systemic illnesses, including heart disease and diabetes. So believe it or not, an unhealthy mouth can also affect the rest of your body.
Mm-hmm.
Wow, that is so interesting. And I'm assuming that based off of just this, there are maybe some common myths that people, think when they think about teeth.
Yeah, there are a lot of myths out there. A lot of things I hear often is, teeth don't matter, they're not as important as the rest of your body, which I understand, but they are linked to other conditions. There have been several research studies that have shown that periodontitis, otherwise known as gum disease, can be associated with heart disease and diabetes, as they go both hand in hand. Both are chronic inflammation processes in the body. So as you can imagine, with the chronic inflammatory processes in your body, the bacteria that multiplies inside your mouth can get into your bloodstream and affect, the other conditions that you have as well.
Wow. And like gum disease, is this something that people can notice right away they have in their mouth? Right. Or are there, symptoms leading up to it?
There are some symptoms leading up to it that you can watch out for, especially bleeding gums. When you're bleeding when you brush, that's a sign of gingivitis. Or noticing that your teeth are becoming more and more loose and more mobile inside your mouth, that's a sign of periodontitis. And, the best way just to keep up with it to help prevent those diseases or to help minimize the progression of those diseases is by doing your constant checkups, your routine checkups every 6 months or so often. That way we are able to detect it at an early stage and can treat it accordingly before it gets too severe.
Mm-hmm. Now you say every 6 months. Now would you say that that's the how often people should visit the dentist, or do you think that it should be more often than that?
Well, routinely it should be every 6 months ideally. Mm-hmm. Every 6 months where we do the checkups, check if you have any cavities or any gum disease, do a cleaning. So every 6 months is standard. Now, if you do have periodontal disease, periodontitis, and you're already in the more moderate severe stages of that, then you may be recommended to come every 3 to 4 months to get your periodontal maintenance checkups and cleanings, since you're at a more severe stage of that.
And does this apply, like the 6 month checkup or the 3 to 4, apply to every single stage in life, as in like starting from kids, or when should kids start going to the dentist as well?
Yeah, that's a great question. So we recommend babies to start seeing the dentist either when they turn 6 months old or when their first tooth erupts in their mouth. So I know a lot of people don't know that, but it's very important to bring babies, to go see the dentist. Not only once their first tooth comes out inside their mouth, that way we can keep an eye on it. We clean it. We make sure that you don't have any cavities. We also do a lot of education during those visits. We educate the parents on how best to take care of their kids' teeth, how to help prevent cavities, and so forth. So it helps with all of that, but it also helps the kids become used to going to the dentist, because as you can imagine, if they're in an unfamiliar place, they'll start crying. They might not want to. And that's when you start to see a lot of anxiety and fear about the dentist come up.
And I think there's already like an existing fear and anxiety about the dentist, whether it's because it's portrayed a certain way in movies or like in children's book, and sometimes like going to the dentist is kind of like scary. Is there anything that we can do to like minimize that fear and anxiety in kids?
Yeah, I mean, that fear and anxiety is very common, and I totally get it. It's very understandable. As dentists, we work inside your mouth. That's a very personal space, a private space for you, and not only that, but it's also a very sensitive space. So I can imagine if you've ever had a bad dental experience, it really does traumatize you for years to come. But at least I, as a dentist, we really try to make your visit as comfortable as possible. I try to listen to you, make sure that you're feeling heard. That's a lot of things that I've heard patients say, I just feel like they don't listen to me. Mm-hmm. And that's one thing that I really try to focus and emphasize with my patients, that they are heard. I listen to all of their concerns, and we really try to make it as comfortable as possible for them, whether that's giving them the breaks that they need during the treatment. We also have TVs there, so they can watch TV while we're doing the work on them. That also helps patients as well.
Right, to relax.
To relax, exactly. Blankets, anything that'll help them relax. Because I know it's not fun going to the dentist.
It's always like associated with pain.
Yes.
And that should not be the case, right?
No, it shouldn't. And that's one of the main things, we as dentists try to emphasize. When it comes to pain, tooth pain, and all of that, it's when the cavities have already grown too big that you need more of the invasive dental work, whether that be root canals or extractions, which, as you can imagine, are a bit more, invasive in the mouth.
Right.
Rather than doing preventive visits, routine checkups every 6 months, where we can catch things when they are small and they're not hurting you yet, and then maybe we can just do fluoride or other preventive measures, or even small fillings, rather than waiting for things to get bad when they hurt you, and that's when you need the more extensive treatment.
So really, that's where it's at.
Yeah.
To not have an awful experience.
Hopefully.
No, that firsthand.
Yeah, another thing I'd like to add on to that is that, it's very important to keep baby teeth healthy. That's another.
Even if it's just the two, right? Like they're small but mighty, and they hurt when they bite you.
No, yes. I mean, kids can bite really hard. Don't put your fingers in their mouth. They bite really hard.
Yeah.
But a common misconception is that baby teeth don't matter, even if they have cavities, because they're just going to fall off. Mm-hmm. And that's just not the case. Not only do big cavities on baby teeth, they can cause pain. No one wants to see their kids in pain. Mm-hmm. So that's one of the things that can be caused from that. Another more severe consequence could be swelling. If you have a big cavity on the baby teeth, it can lead to swelling, not just inside your mouth, but it can also spread out to the outside of your mouth as well. You're swelling on your cheek, under your chin, and all of that. And that's when we see the more severe, life-threatening swellings that can happen in children. And that's when things get really serious.
I bet. Mm-hmm. Also, what would be kind of like, maybe not the number one, but the most common problem that you see in patients down here in the area? Well, what would that be?
Just widespread cavities. Yeah, childhood caries. That's very prevalent, unfortunately, in our community. A lot of children with cavities, and most of the times it's not just small cavities, but pretty big cavities. And it all has to deal with how cavities are formed in the first place, which is, with bacteria feeding off the sugars in the foods that we eat. They secrete an acid that causes the cavities on your teeth. So a lot of sugar consumption with junk food, juice, and all of that will cause cavities to start and spread and become bigger.
So we highly recommend maybe like a change in diet, because obviously here, if we're talking about kids, parents are the ones buying the food for them. I mean, they're not just grabbing it off the shelf on H-E-B. Like the parents are either buying that food or maybe cooking certain foods that are not helping, right? So maybe this should be targeted for parents and have that in mind.
Ideally, I mean, in a perfect world, but we all know kids love candy, kids love sugars. If a kid's crying, you're going to give your kid candy to calm down. So I totally get that. But sugar, candy, all of that stuff does play a major role in getting cavities. So one of the main things I would recommend is limiting, sugar consumption just to certain hours of the day. If you can't eliminate it completely, it's better to have just a certain, time period, 30 minutes or so of, sugary food rather than extending it throughout the whole day. Because if you drink or you sip on some juice throughout the whole day, you're leaving that sugar in your mouth for longer periods of time, and that's where the bacteria and all that stuff feed off of it. So that can cause more harm than just, drinking juice maybe during lunchtime or in a 10, 20-minute window.
Yeah, you got to drink water at some point to wash out your mouth.
Yes, exactly. Drinking water afterwards definitely helps as well. So all of those things just to keep in mind to help limit, cavities, because obviously brushing twice a day is the recommendation. Brushing twice a day, especially before bedtime, and also flossing every day. All of that helps, prevent and minimize cavities, especially the flossing. I know no one likes to floss.
It's kind of like that extra step where you're like, it's already clean, but is it really?
Right. Would you say that some of these practices like fade out as you get older?
I wouldn't say they fade out, but I know we all get really busy. We get really busy.
You get real busy,
with work.
you forget.
Yes, especially if you work long hours, you get home late. You just want to go home, sleep, and
teeth are kind of like the last thing on your mind, right?
Yes. I completely get that. But flossing is important because, as you can imagine, our teeth, contact each other. In between the teeth, those are areas where the toothbrush doesn't reach into that area. So if bacteria, food, plaques stay stuck on there, that's how cavities start forming. And they can easily spread from tooth to tooth in those areas. So that's where, flossing becomes important. Brushing twice a day, especially before bedtime. All the food that we ate throughout the day, we don't want it to stay on the teeth overnight, because otherwise, again, the bacteria become active. They eat off the food that's left there. They create the cavities. And it just becomes a problem, a cycle.
Right. I guess that's why it's important to develop those habits early on so you don't forget them.
Yes, and it goes back to, bringing kids to the dentist,
Absolutely.
Getting them used to going to the dentist, establishing healthy habits at an early age. And that's honestly probably one of the best gifts you can give to your kid, helping them establish good, healthy habits so they don't have problems like, let's say they have a lot of cavities as a kid. It's really hard for them to change their habits as they start to get adult teeth. Habits are usually not changed from one day to the next.
No, yeah.
And the thing that a lot of people don't know is that kids start getting their adult teeth as early as 6 years old. So at the age between 6 to 13 years old, they're in a mixed dentition stage, meaning they have a mixture of adult teeth and baby teeth. And if they have those unhealthy habits going on, they're already affecting their adult teeth.
Right.
Yeah, and it can become an issue for them. Like it can stress them out too if they feel like their teeth are looking bad and school.
Oh, I think that's such a hit to like confidence, to self-confidence. If I may share something personal, I needed braces when I was around 11, 12. And of course it was like self-conscious on both parts. First because of how my teeth looked before, and then because I had the braces. But what helped me out, like silver lining after all these years, is I developed such healthy habits of how to brush my teeth, because I had to be extra careful with the braces and what I ate, and for not to have anything stuck. And I love laughing. So, I wasn't going to laugh and have, a piece of cilantro on my braces, right? So those habits continue to be with me till this day, because I find myself that I brush my teeth the same way as if I still had the braces, which I know but you have to be there in a bit longer, They said always like 16 seconds per kind of like by side and all this. So, of course, the mouth is kind of like your smile. It's what people sometimes see, It's the first thing that they see sometimes or that they notice. So I can see where it can be such a hit to self-confidence and like your self-esteem, even as a kid and growing up, that you have to have like a healthy mouth,
Yeah, I mean, the key to confidence is a healthy mouth. As you mentioned, you smile. That's one of the first things people see. And ideally, we want everyone to have a healthy mouth. That's, what we want in the perfect world, for everyone to have healthy mouth and no cavities. But it really starts at an early age and with prevention and all of that.
That's so true.
One thing that I noticed is that the last couple times that I went to my dentist, after the procedures that I had, he was very much just like, do you have any more questions for me? And I'm like,
don't keep them in there.
Nothing came to mind, because at the time I'm just worried about like, the pain going away. But like, I feel like not a lot of, or at least that I've noticed, I think it's good for your dentist to also ask these questions too, like give you the opportunity to ask more questions.
Yeah, definitely. And that's a big part of patient education and helping patients feel heard, is asking them if they have questions, because sometimes just patients, they're too shy to ask
Right,
questions,
you have to
or they're
pull
a
it
little
out of
intimidated.
let's not say pull because they're going to say the teeth pulling. But you have to really work to get the answers out of them.
Yes, and it's all about developing that trust between, the provider and the patient. The more comfortable they feel with the dentist, the more likely, patients are to ask questions. And that also comes, in part from the dentists themselves, asking the patient, do you have any questions? Is there anything I can do to help you feel more comfortable right now during this appointment? And, getting their feedback as well.
Dental offices and public health programs, how can they work together so we can close gaps in the area, especially dealing with oral health or any dental issues? What do you think that there is to be done, or how can we work together?
Definitely. That's an excellent question. And there's definitely a lot that can be done to work together, close that gap, and help minimize, the childhood caries situation, the cavity endemic here in the Valley. And one of them is by, establishing programs within the schools. That would be a great way to start. I know back in San Antonio, when I was doing my training in dental school, we would go to the elementary schools. We would place fluoride on their teeth, and we would place sealants on their teeth. So those are two preventive measures we can do that help minimize the chances of them getting cavities. So that's something that maybe we can start implementing here in the Valley as well. And it all starts with patient education. So that's one of the things that I like to focus on with my patients, taking the time with them to educate them on how to take care of their teeth. Because believe it or not, a lot of people say, well, I was never taught how to properly brush my teeth.
I bet.
Yeah, and there's a certain technique to it. I mean, you don't just brush 5 seconds and think that's going to be enough. There's a certain technique to it. So it all comes down to patient education, taking the time to teach, our citizens how to take care of their teeth, whether that's in the dental chair at our office or in outreach events, doing presentations, lectures. All of that is super important. And as mentioned before, the key to a healthy smile, or key to the confident smile, is a healthy smile. So that's what we try to have, in our community, have patients and people feel like they have a healthy smile.
Great. What would you be able to just maybe showcase a bit of what that routine looks like so people know?
Yeah, for proper toothbrushing?
Yes,
of course. So ideally, it's 2 minutes more or less, a minute or 2 minutes of brushing your teeth. You want to make sure you're brushing kind of in circular motions on all surfaces of your teeth. So that includes the very back teeth and the front teeth, on the cheek sides of the teeth, on the chewing surfaces of the teeth, and also on the inside surfaces where the tongue and the palate are. So you want to make sure you reach all of those areas, not just the front teeth, but also in the very back, because the very back you have your molars, your back teeth, and that's where a lot of people end up having a lot of cavities in those teeth if a lot of food stays stuck in that area. So just brushing routinely, circular motions on all surfaces of all your teeth, including along the gum lines as well. You want to get rid of any plaque that stays along the gums of your teeth. And flossing every day. In addition to flossing, y'all can look into water flossers. I know they've been around social media recently, but water flossers are a good aid to help also with keeping a healthy mouth. So ideally, water flossers are meant to be used in addition to traditional string floss, but I know some people may have difficulty using the floss, with manual dexterity, arthritis, and all of that stuff. So a water flosser is better than nothing,
Wow.
You can look into water flossers to help clean in between your teeth. And also brushing the tongue. A lot of people don't know that they have to brush your tongue, but if bacteria stays on your tongue, that's a common cause for bad breath. So brushing their tongue thoroughly. I think they have some tongue scrapers out there. You can look into it. But all of those measures will definitely help, with brushing properly and keeping a healthier, cleaner smile.
Thank you.
Yeah, very nice.
I know. Before we wrap up, if you could give the entire community one oral health tip, what would it be? I know you kind of said it, but I wanted to ask it.
aside from the vast knowledge that we just gained, what small little tip can people walk away with?
It's a simple tip. Just brush your teeth. Please brush your teeth. The best thing you can do is brush your teeth. Yes, brush your teeth morning, especially before bedtime. Brush your kids' teeth, even though you think they might be brushing by themselves. They might not brush properly, so help them. It doesn't matter if they're 9, 10 years old. they would benefit from getting some help with brushing, and just reviewing all the preventive measures that we discussed. All of that will definitely help with fighting against cavities and so forth.
Well, you heard it here first, guys. When in doubt, just do it. If we want to know more about you guys, where can we find more information?
Yeah, of course. You can find us. We're on social media and we have a website. We are called Key Dental. We are located in Brownsville by the Expressway in the same plaza as the FedEx and the Sherwin-Williams. And we are open Thursdays through Saturdays, 8 a.m. to 8 p.m. So evening hours and weekend hours for those that can take time off of work or have school. We do see a lot of, patients that do have restricted schedules because of that, or emergency walk-ins. We also see a lot of those. You can find us on our website at keydentalrgv.com or on social media such as Instagram and Facebook, TikTok. We're called YouTube, yes, Key Dental RGV.
Alrighty. Well, thank you guys so much for joining us on another episode of Health Yes. Thank you to our lovely guests from Key Dental for joining us today.
I'm sure our listeners will find this information very helpful and useful. And speaking of our listeners, Javi, make sure to follow our Facebook page, like us on Instagram, subscribe to our YouTube channel, and turn your notifications on Spotify so you never miss an episode. Remember, stay healthy, stay safe.
And keep those mouths clean. We'll see you on the next one.